Hey, tēnā tātou. Nice to see you back. I hope people manage to get out and enjoy moving in the sunshine. This session is about exercise and how you might help your patients get the right dose. Now this is James. Hopefully it'll work. He's somewhat quieter though, so you have to be careful, cautious to hear.
Ko te pū, ko te more, ko te reo, ko te kapa, ko te rea, ko te wāne, ko te kune, ko te whe, ko te kore, ko te pō. Ki ngā tangata Māori, ngā rangi nui, ngā papatūni, ko tēnei te timitanga o te ao. Ko tēnei te timitanga o te ao. Tihei mauri ora.
So that's the karakia they started, because this is a few years ago now, they started school with every day. Just so different to the way that I started school, which was James, Ben, Lucy, and as a way to get them all engaged and together, so much more fun. Okay, so what we are hoping that you will learn in this session is ways in which, I mean, you all know about physical activity, but I want you to have ways in which you can describe the impact of physical activity on health to people whom you're trying to enhance the health of. But also to have ways in which you can assess someone's level of physical activity, and we will assess your own levels of physical activity as a way of practicing that. To have ways in which you can discuss physical activity with the patient, and we will have a role play session where you can do that with a resource that you might find useful, and ways in which you might empower and support someone to engage in higher levels of physical activity. So the question is, why do we want to exercise? Hard to find out where to position oneself in this room. Big pillow where I'd like to stand. This comes from 1873. Those who think they have not the time for bodily exercise will sooner or later have to find time for illness. Quite profound, eh? But what amazes me is that's from 1873, and we've completely ignored that whole concept for 150 years worth of medicine and health care in general. And really we are paying the consequences now, because there are huge numbers of people who are having to find a lot of time for illness. So there is very strong data that people who exercise more live longer. This is from a meta-analysis in the BMJ, where they looked at, so a MET is a measure, so it's the metabolic equivalent of what you're doing. So whilst you're sitting there right now, you're all gaining 1 MET for every minute you sit down. So you'll gain 60 METs as a result of doing nothing through this. If instead you spent that hour running, you would gain 8 times as many METs through doing that. And so across a week, the more METs you gather, what this study shows is your relative risk of having to make time for one of these very time-stealing illnesses is proportionally decreased. And you can see there's sort of an inflection point. They found somewhere around 4,000 MET minutes per week. But it is a very slippery slope as far as ischemic disease is concerned. So every little increase someone makes in how active they are has a virtually measurable impact on their risk of having one of these diseases. So that's how much time people spend doing physical activity. This is from a different study where they looked at how fit people were on treadmill testing. Now this is a big study. This was 122,000 consecutive patients. That's a data set, hey? And what they found was an inverse association between all-cause mortality and how fit people are. So if we look at that more graphically, there's a direct dose-response relationship, which is a contributor to an understanding of causality, and that was similar for men and women. Okay, and there's no upper end to that, but with the corollary that those in the elite end, when they overtrain, their fitness actually decreases. And so likely, therefore, it's not having as positive an influence on reducing their all-cause mortality. And I did hear there was a study been described on the radio at the weekend that they're done in Scandinavia, which did show, again, there is a U-curve that people who are incredibly active no longer get that same reduction in mortality risk. Now, what the evidence says is that, not only is it what you've done in the past in terms of your exercise levels to reduce your risk, increasing your activity levels at any stage will start to give you those benefits. And so what it means is that it is never too late to increase your activity levels. You will consult with people who say, I've never been physically active, sport's not my thing. It's not something that I've done, or there's no point starting now. What the evidence says is there's every point in starting now. In the same way that there's every point in stopping smoking now, you will start to accumulate health benefits from the moment you do that. You will start to accumulate health benefits from the moment that you start increasing your physical activity levels. Excuse me, could somebody over there just close that door? Thank you. Not only do you live longer, but you also live better. And so, the question is, exercise effective in promoting well-being in old age? And the answer was clearly a yes. Can resistance training improve mental health outcomes in older adults? The answer was clearly a yes. If older adults are less active, so those who are physically active have healthier aging, better quality of life and improved cognitive functioning. Those who aren't have increased risk of all cause and cardiovascular mortality, breast and prostate cancer, fractures, falls, ADL, disability and functional limitation, cognitive decline, Alzheimer and dementia and depression. So a whole range of things that would reduce your quality of life as you age, that you will reduce your risk of if you're more active. But also, being more physically active helps you to recover from health challenges. So these are just Cochrane reviews. Most of things that are looked at, exercise has a positive impact on, whether it's heart failure, cancer, fibromyalgia, chronic fatigue, depression, osteoarthritis, diabetes, list goes on. So exercise appears to be a positive intervention for most long-term conditions that humans experience. So because of all of that, the Minister of Health, consistent with the World Health Organization, recommends that adults get 2.5 hours a week of moderate or 1.25 hours of vigorous physical activity. But if you double that, you will double the health benefit. Unfortunately, only 50% of New Zealanders meet that guideline, which means there are a lot of people for whom you will have to make time for in your consultation rooms who wouldn't need to be there if we manage to support them and enable them to be more physically active. So, we also need you to be in your consultation rooms, or else you won't be able to put your medical degree to good use. So, we need to know how active you are as well. So one way in which we can assess activity is with the International Physical Activity Questionnaire. This is the short form of it. So if we can pass those out and you can fill that in. Take one and pass them on. So within this, it will ask you how many days in the last week did you do vigorous physical activity. It'll then ask you, on average, how many minutes did you do a day, and then it asks for moderate, then it asks for walking. Once you've got those 6 numbers, put them into that panel on the back, and so that you can then add them up, and that will tell you how many METs you gathered over the last week. There's then one more question at the bottom that we'll come back to afterwards. So please complete that. Get yourself a score. You won't have to share the score with anyone, but it will be a useful reference for yourself. Once you have completed that, please stand up, because then I can know everyone's done and then we know when to move on. But also those who finish very quickly, often can use the extra time on their feet. Thank you. Okay, so don't stay standing. Have a look at your number. And then have a look at the graph and see how well you are doing at reducing your chance of... So, did anyone get over 8,000 minutes? Nobody got over that? So, WHO did a study, or a process a few years ago, where they wanted to work out what the factors were that most contributed to reduced health and having long-term conditions. In order to do that, they came up with a binary classification, well, not quite binary because there's a gap in the middle, but a classification of whom was active and whom was inactive. They defined an active person as one who gained more than 8,000 METs per week. That's nuts, yes. It's a consequential decision. Next question is, who got over 4,000? Okay, you can sit down, because you fall into the grey void. You can have a rest. According to the WHO, all the rest of you are inactive. Well, no, but the point about that is I'm sure there are a number of you who are still standing who consider yourself to be quite active people. But because of that decision, it meant the WHO rated physical activity as 21 out of the 25 potential contributors to long-term conditions. By using a crazy, I would say for me, that level is probably closer to where I would consider people to be inactive. It doesn't mean that people who are getting 4,000 cannot get additional benefits by doing more. But it shows the importance of thinking carefully about what question is being asked to come up with a recommendation before you start implementing that in your practice. But it still means that all of you, there is the opportunity to become healthier through exercising more. You can sit down now, or we can stay standing up if you want to keep gaining a few more METs out of the next time. Now, for those of you who were worried about what your numbers were there, METs is one way of measuring how active you are. A different way would be for you to wear an accelerometer all week. There are pros and cons with each. People put the accelerometer in the washing machine and so it doesn't work. They put it on their dog so they get extra minutes even though they're not doing so much. But what this study suggested was that they thought that deflection point of the maximal reduction for how much activity you're doing was at 24 minutes per day of moderate to vigorous physical activity. Now that's substantially less than 4,000 METs, but that last question on your form was how much time do you spend sitting a day, and there was a completely independent relationship that those who sit for over 9.5 hours per day have an increase in all-cause mortality as well. So you as a population are at risk of that, which is why when someone says in between lectures you should go out and have a bit of a walk around, I strongly encourage you to do so, because we'd rather that you were staying healthier for longer. What questions do you have about METs or measuring physical activity?
Well, this worksheet didn't consider how much you were standing.
Yes.
Because that's...
Do you think you earn a measurable increase in energy standing versus sitting?
Well, I hope, yes.
I would say it would be probably not worth doing the extra math because the difference, I don't know the research, but I would imagine I'd be surprised if it was more than 1.1 METs. The whole thing with standing desks, they've shown that there's no reduction in things like diabetes for people who stand at work versus people who sit at work. Standing still is probably no better for you than sitting still. Has different costs and consequences. You know, if you've got any vascular issue, well then obviously your risk of having accumulation of fluid in your limbs is much greater when you stand than when you sit. I think most of the reason why standing desks are in most offices is because if you're a desk manufacturer and every office already has desks, your only option is to make a new one.
Are they good postural leaders? Do you know?
Posture's a myth.
Oh, okay.
Oh, hang on.
Anyway, that's a different lecture. Okay. Tama tu, tama ora, tama noho, tama mate. What does that mean? Anyone? If I say etu, what do you do? Etu. If I say noho, what do you do? Okay, so if I say kia ora, what am I wishing you? Health, well-being. Mate, ka mate, ka mate. Anyone know what mate means? Yeah, death or illness. So, is anyone willing to take a guess what tama tu, tama ora, tama noho, tama mate would mean?
If you get up, you've got better health than sitting down, at least not death, but...
Yeah, they who stand, who get up, who are active, engaged, are healthy. They who sit are they who get unwell. So it's not just Edward Stanley who knew this. This whakatauki is much older than Edward Stanley is. But again, you can see there is knowledge that's been there for a long time that we have not been integrating into the way in which we manage people's health. Now, we'll also point out that most of the guidelines focus on cardiovascular health, but muscular health is really important as well, muscular and bone health. So resistance training to stimulate bone strengthening and bone health and muscle strengthening and muscle mass are really important because osteopenia, sarcopenia and osteosarcopenia all are associated with negative health outcomes, and you know that mortality risk is quite a lot higher. So the WHO recommend muscle strengthening activities on at least 2 days a week. This is an image that came from that article on Can Resistance Training Improve Mental Health Outcomes? So it's not just improving bone mass and muscle mass, but it's also having a positive impact on cardiovascular risk factors and depressive and anxiety symptoms as well. So yeah, encourage you to consider both for your own health, but also when you are engaging with and discussing with patients. So as a result of all of that, empowering and supporting patients to be active is probably the key opportunity that you have to improve their well-being. And much more powerful than short-term responses to acute problems or even long-term condition management. It'd be much better to stop them developing the condition if you can. Now, not everyone's going to have the time to do an IPAC with every patient in the clinic. So there is a concept of considering physical activity as a vital sign for which you do a brief screen in the same way you might do for blood pressure or you might do for heart rate. In a way that therefore can be assessed as a standard part of each consultation, taking less than a minute. And what that will do is it'll provide you with the information that says whether or not this is something that we need to devote attention to, but also in the same way that asking someone whether they're still smoking each time they come in gives another chance to reflect and highlights actually the value that you put on that as an impact on their health, does the same thing for physical activity. So all you need to do is ask, on average, how many days a week do you engage in moderate to strenuous exercise, like a brisk walk? And on average, how many minutes do you engage in exercise at that level? Multiply number 1 by number 2, And there you can see, is that at least exceeding 150? And therefore meeting the New Zealand Ministry of Health guideline? Or actually, is there an opportunity there that is being missed? You might not engage with it on that day. You might, but you might think there's an opportunity to come back and talk about that at another time. Having identified the problem, you then want to be able to discuss physical activity. Now, we're going to do an exercise with this. As part of that exercise, you're going to assume that you have a condition. So what I want you to do is to decide whether you're a young person or you are an adult. If you're a young person, you can choose for one of these 6 conditions. If you're going to be an adult, you can choose from one of these, 15, 16. So just make sure you've chosen one. Has everyone got one? Good. Because these come from Moving Medicine UK. Has anyone seen Moving Medicine? It's a very good website. Feel free to get up and dance if you wish. More Mets from dancing as well. Wouldn't you love it if you walk into your consult room and that's what your doctor's doing? You say it's concerning. Okay, so Moving Medicine was designed to help health professionals have conversations with people about increasing their levels of physical activity. Within there are a range of consultation guides, which therefore means you can select a consultation that matches the person who you are dealing with. Now, so if you're a young person, you've got that list of options. If you're a child, they've got the same options. If you're an adult, you can't get asthma. Now, I'm not quite sure why that is, but you have amputee, but asthma drops off the list. But beyond that, so what you can do is say, okay, I'm an adult with ischemic heart disease, and then you go to find. And so within that, it has a 1-minute conversation with then a guide of the question or questions you might ask within that minute to go with it. What I want you to do, now it works on a motivational interviewing type model. So it's all about asking, inviting those sort of things through there. But the questions are all worded in a way that follows that approach, and so you don't need to have done the full motivational interviewing training in order to actually be guided by the principles that have been shown to work for engaging in behaviour change conversations. So what I want you to do is to go and practice the 5-minute conversation. So break into pairs. You'll likely have a different condition. If you both miraculously chose the same one, well, change one of you. But try and work through those questions. For each question, it's got an insight as to why you might do that. it's got some extra content and things, and then the impact of what that might be. So go and practice, because like everything, it's hard to have these conversations if you've never had them before. But actually, the more of them you have, the more comfortable you will get. What I encourage you to do is to spread out in this room, spread out in the space. So you can go around that area down the end where you can go and sit around there, or so that you've got space so that you're not feeling like you're performing for anyone whilst you're doing it. That's going to be 5 minutes each, so that means we're going to restart at 13 minutes past 1, because that gives you a minute to get there and back as well. Do you have any questions about what you're doing? Excellent. I will see you in 12 minutes' time. How was that? Saved a life? Did I hear?
Yeah.
Good afternoon at the office, eh?
You know it.
So how did that feel as the health professional having the conversation?
Well, I just felt like it was kind of like NPC, kind of like robotic, because like, I was just like reading off a screen.
Yes.
And then they just answered it. It's like, all right, moving on. We'll ask another question. And you didn't acknowledge anything they've just said. You just asked like the next set question.
Yeah, and so with anything where there's a guide like that, it's always robotic when you start using it, because you're so focused on remembering your next question that you forget that the whole point of asking the question is to listen to and engage with what the person said. But through practicing, first of all, with a guide like that, then helps you get the flow and the idea of the concepts that you're trying to cover. And then you can start to make it into a conversation once you get more comfortable with that. But if you don't have the initial practice with, don't have that resource to engage with initially, then often that barrier to getting there and asking and having those conversations is so great that people don't cross it. And so, yeah, completely would agree with you. It's robotic, and it's probably not your patter, the way in which you might normally talk and relate. And so adapting it to that is a great thing to do, but you've got to have the framework before you're able to do that well. Others? Yeah?
It didn't have many examples of forms of exercise, so it just said we'd recommend exercise or maybe brisk walking, but it didn't give, for example, swimming, boxing, and all these different examples to give the patient.
Mm-hmm. So do you think those examples would be good to give the patient, or there might be another way in which you could receive that information?
You ask them what they're interested in.
Yeah, so I would be seeking from them what interests them. What can they do? What's accessible? What is within their community, within their resource, but within their interest, because it's those things which are much more likely to be able to become behavioural habits and that are self-sustaining because people are doing things that they love. And actually the type of exercise is much less important than the exercise. And so certainly if they've got specific goals in terms of I want to get stronger, or having something that has a resistance element to it is a good idea. If it's that I want to be able to play for longer with my children, or having something that's got an endurance aspect, and it might be. But actually, finding out what suits them and what is most meaningful to them is probably best. And that's probably why it doesn't go, because you can get yourself into a rabbit hole and people start to then focus, it must be that swimming and badminton are really good for heart disease versus rowing and shot putting are really good for stroke. Whereas actually, it's what suits the person, which I'd get you to focus on. Who, as a result of that conversation, is going to be more active in the next week? Right. I thought you'd saved a life.
We've already maxed out our stats.
I encourage you to keep practicing those conversations and think of all your loved ones whom you might give more life to, and more love, through helping them to be more active as well. And having more practice will help all of those conversations to go better. And so again, I'd really encourage you when you're in clinic to see whether or not You can say, hey, is it okay if I take this person to another room? We just have a quick conversation about physical activity. I am sure the GPs and nurse practitioners and others you're working with would be delighted. And then it just gives you another opportunity to practice. Okay, last thing that we just want to briefly touch on is some common pitfalls that happen when trying to help people to be more active. First one is, if you exercise, you'll lose weight. Does anyone know what the evidence relationship is with that statement? Well, it's not entirely false, but it is very unlikely you will be able to measure any change in your weight as a result of increased levels of physical activity. Statistically, they do find there is a reduction when people adhere to the program, but it's not one you can measure on the scales at home. And it's probably the wrong outcome goal. If you exercise, you will gain health. Much better conversation, and then the person's much likely to be able to perceive those benefits, and they're much more likely to be measurable. Second one is, if you exercise, you will hurt less. Now, there is a positive relationship between physical activity and pain, but it's not like you take your walk in the same way that you might take, well, I used to say an opiate, but now we know opiates don't work, but in the way that you take a pain reliever type pill, maybe a morphine injection. And so this is what Craig said to me. He had been to A&E with his acute back pain. They'd said, if you exercise, it'll hurt less. He went for a walk around the block. He said, I thought if I exercise, my pain would go away. It didn't. So I'm not going to bother with that anymore. It's not helping. Whereas if you walk around the block, you will feel better. If you walk around the block with your wife, you might have a nice conversation. You probably won't be focusing on your back as much as you were whilst you were lying at home. So they're quite different conversations. You can measure that you've had a conversation with your wife, but the direct measurement of pain, not that good. Now, yeah buts are always there in any behaviour change conversation. Yeah buts in relation to something like osteoarthritis. James said, well, am I strengthening it or am I sort of destroying the cartilage? I don't know. We want to elicit the yeah buts so that we can relate to people other sources of information that might help them to resolve that uncertainty. So we've done a lot of research with people with musculoskeletal pain around this, and people with low back pain clearly balance the risks and the benefits of activity within a context. So these aren't thoughtless decisions people are making about whether they should or shouldn't. They're actually taking a lot of factors into account and balancing those risks and benefits. Same thing with people with osteoarthritis. They've got a range of things that they're trying to balance when coming to these decisions about how they manage themselves, and particularly around activity. We'll talk about osteoarthritis later in the week, so we won't worry about it now. But beliefs really do drive behaviour, and there's that balance that people do. And so Steve loved playing basketball, but he said, look, as a calculated risk, it seemed like a bit of a dumb idea at the moment. All of those decisions are made within a specific context. But what was really interesting is that people valued the psychological and social benefits of activity far above the physical ones. And if you think of what health professionals spend most of their time relating to people, they are the physical benefits, and more often than not even the benefits, they're the physical threats. Oh, if you don't exercise, your back won't heal so well, and then you'll injure it again more easily next time. If you don't exercise, you'll decondition, rather than the benefits. And we know from a range of smoking cessation or road safety type data that threat is a really poor way to drive behaviour change. And what Moana said is, keeping active is definitely positive, physically, but also more for me mentally. And so the model we came up with from a range of research around that was around the things that might bias people towards doing more physical activity, so the benefits they perceive, and right at the top of that, people enjoy being physically active. But also, they know that when they're more active, their mood raises, and when they're less active, they feel more depressed. that when people are being active, their focus can shift away from their pain. They start to feel more free and in control of things. They're able to get on with their life. Often people have really positive social interaction whilst they're exercising, and they do look at improved health and pain relief, but they weren't as important. Whereas the things they were worried about was more pain and more injury. And so that's where that graph that we went over in the pain session can be a way in which you might discuss that with people. Also pain has an emotional cost, but that concern about being a burden on others, and then the whole range of things that will change that balance. So Moana, I saw her, she'd come into work the day that I saw her, which was just after she'd started, had onset of pain. She said, I would not have come in today, but I had a job interview, so I did. So the context of that job interview shifted the balance from day in bed to day in the office because the job interview was very important. And so understanding that context is vital. Now, it's not just our work that has shown this. This is from a systematic review as well, where they found that physical activity contributes to all aspects of quality of life, and that the social and emotional benefits may be the primary motivator for community participants. So I really encourage you to broaden your lens when thinking about and discussing those with people. Now, once you have got people more active, you want to then provide them ongoing support to maintain it. And what evidence says is that even just a telephone call from the practice is enough to result in a measurable increase in adherence to a behaviour change. So if you can set up systems within your practice that enable that to happen, you'll have a more positive impact on people. There's also support that is available through green prescriptions. And so in Wellington, it's done through Nukuora. And there's a whole range of support that they can provide to people to encourage them and enable them to participate in more physical activity. So their website is through that QR code if anyone wants to go there, but I would strongly encourage you to have a look through because in terms of the impact on people's health, that will likely have as much impact as the formulary that you look up quite regularly. Very few side effects as well. For yourselves, I mean, we've got quite a cheap gym just up here, but if you live further away, often through the Exercise Association of New Zealand, you can also find cheap gym memberships. You need to tell them you haven't belonged to a gym for at least 6 months, which obviously you wouldn't tell them if you had, but they are subsidised often at 40 to 70% off the normal price of membership. And it's just whichever gyms are giving away memberships at that time, they have a list. And so worth knowing about for sharing with patients, but also if you like to gym yourself. Final graph. This is from a paper in JAMA year before last. And what I was looking at was what would happen if American adults added 10 minutes a day, or 20 minutes a day, or 30 minutes a day of moderate to vigorous physical activity into their lives. And what they calculated was that if they just increased 10 minutes a day, America would save 110,000 deaths a year. 20 minutes, 210,000. 30 minutes, 280,000 deaths. 280,000 people. That's Wellington. And the thing with that is, it's not like these people just suddenly stop. These people who are dying from things caused by inadequate physical activity have a protracted and uncomfortable end of life, which also has significant impacts on the health system and takes resource away from what we could use to build other people's lives and at different stages of life. So yeah, it's really quite stark when you think of what the opportunity is there that we could realise if we just changed a little bit how we talked about health and how we talked to the people we interact about their health. So the summary is that exercise is good for all of us. Physical activity is a key way that you can improve your own lives and those of your patients. And that when doing so, it's really useful to explore what they perceive are the risks, what they perceive are the benefits, and what the context is within which they're making these decisions. And that is physical activity. What questions do you have?
Well, I've just got like point of objection, I guess. Like,
Yeah.
I mean, I acknowledge that like exercise is really good for you, but it's just like, for example, that WHO graph, like just saying if you go above this line active and this line inactive. I mean, but people like they have their own lives. I mean, like people, their job is they sit down all day and doing things, and they have to feed the kids or pick up the kids, and they're driving, and they live far away, and then by the time they get home, it's like the evening, and also like some people, they don't enjoy going to the gym or running, they enjoy playing sports, but then sports is, you have to join a team, and then you're not, just because you play one sport doesn't mean you'll be getting that moderate exercise every day, or because you're playing like once or twice a week or something like that.
Mm-hmm.
So it's like, I'm sure like a lot of people know that exercise is good, but it's like practically how do you actually do it? And some people, they live in dangerous neighborhoods, like, I mean, just in down the road, I don't want to run it after 7 p.m. in my neighborhood. So I mean, it's like,
Yeah, and look, that's why you've got to explore the context very well. Now, that WHO inactive active classification, I think, was craziness. I agree with you. And that's why that physical activity isn't ranked highly enough on their opportunities to reduce long-term conditions. And I mean, for your patient, there's relatively little benefit in making a binary classification, other than, you can say, well, that judgment of 150 minutes means that, whether there is how great the opportunity is to improve their health by them exercising more. Now, I wouldn't suggest trying to say to everyone, if you're not doing 4,000 minutes, you're wasting your time. Every minute of physical activity someone does will add value to their health, or add health to their life. And yeah, like everything when we are interacting and managing people and helping them with their health, it's complex and there's all sorts of interacting factors. But that's the joy, is being able to work with people through their context, through their opportunities and their situation and their values and their preferences, to find the solution that best works for them, that helps them to optimize their health as much as is possible. And I guess for me, that's the thing that I would say is a really interesting thing, because if it was just, we tell everyone they should be active and they go off and they be more active, well, it would be good for them, but it wouldn't be that stimulating as a health professional. Whereas the complexity of that is what really draws on those skills that you'll develop in terms of your interactions with patients.
Yeah, because I think like the easier ways of getting exercise, like gymming and running, it's not for everyone. So people treat it like a chore, like, today I have to get these minutes of running done because I have to get my exercise. But it's a chore, so it's harder to.
Yeah, and that's why finding the type of exercise that works for that person, that they enjoy, that is accessible, that is safe. All of those things that you raised are all really important things to consider, but there's no answer I can give you today, because it's going to be very variable for every individual's context. But if you look at those slopes, anything you do that increases their engagement in exercise more will be good for them. So it's worth having the conversation and worth working through that process.
So we shouldn't have like a target at which we're like, for this patient, we hopefully can get to this level of exercise or something like that.
If the person wants a target, well, by all means, but I think that helping them to gain more health should be your target.
As long as they're doing more.
Well, if they're doing more, they're still healthier than they would have been had they not. And so it's worthwhile your investment. Okay, so look, enjoy yourselves out in clinic, and I really do encourage you, try and have some conversations about pain and the threat that goes with it. Try and have some conversations about physical activity. Observe how much these things are part of practice, and where you think there might be more opportunity for them to be included within consultations, and have those conversations with your doctors as to why they're approaching these things in the way they are. And then, hopefully you'll be able to put some of this in practice. I look forward to seeing you in a few weeks for osteoarthritis.